Hi, everyone. We're going to give it just one more minute, and then we'll go ahead and get started. Okay, it's 1 o'clock. I want to be mindful of time, and I'll keep an eye to see if anyone else comes to join us today. But good afternoon, everyone. Thank you for joining us for today's webinar. I apologize in advance. I will remain off camera while I present. I've just had some internet connectivity issues this week, so at the end when we do Q&A, I'll make sure to turn my video on. But my name is Allison Andrews, and I am the project manager and a neural resource facilitator here at the Brain Injury Alliance of Iowa. And before I get started, I have just a few housekeeping items to review. So first, today's webinar will be recorded. You should have been notified when you entered the meeting. And so this will be available on our YouTube page later this afternoon. Near the end of the webinar, I will be posting a link to a feedback survey in the chat box. We greatly appreciate your input to help us deliver the content you want to hear. So thanks in advance for filling that out. We will have time for Q&A at the end, but please feel free to come off mute or enter questions or comments in the chat as they arise. I don't want to just talk at you today, so feel free whenever something pops up in your head to just let us know. And then lastly, I just wanted to announce that we will have 2 more webinars this week. Tomorrow, we are hosting Dave Anders from On With Life, and Friday, we will have Courtney Sand from the Brain Injury Alliance. Both of these are also scheduled at 1 p.m., and you can find registration links on our website. So with that, we'll go ahead and get started today to talk about improving supports for family members with stroke. Just some brief disclosures. The development of this presentation is from the Brain Injury Alliance of Iowa, supported by a contract from the Iowa Department of Health and Human Services Brain Injury Services Program. And I do just want to note that the content of this presentation is not intended to be a substitute for professional medical advice, diagnosis, or treatment. So please contact your healthcare provider with any questions you have about your condition. So, sorry, I'm trying to multitask. Our objectives today, I imagine that all of you here today have either had a stroke, have a loved one who has had a stroke, know someone who has had a stroke, or work with individuals recovering from stroke. And so with that in mind, I have 3 objectives for today. First, to identify stroke risk factors and warning signs. Regardless of your experience with stroke, it's important to provide awareness in these areas. Second, to review secondary stroke prevention efforts and opportunities to live well after stroke. So we will specifically be looking at some lifestyle modifications for reducing the risk of stroke and reinforcing the idea that you can live well after stroke. And then lastly, we will discuss supports and services available to stroke survivors and caregivers in the state of Iowa. So to kick us off, I just wanted to highlight stroke statistics to really paint the picture of why we're having this conversation today. So 80% of strokes are preventable, and we'll be discussing some risk factors within our control, as well as lifestyle modifications throughout this presentation. 1 in 4 people who have had a stroke each year has had a previous stroke, meaning that this isn't their first stroke. So again, looking at those secondary stroke prevention efforts is important. Stroke is a leading cause of disability in the United States, costing an estimated $60 billion annually. I can imagine that that has since increased. And then 1 in 3 adults exhibits or engages in stroke risk factors. And you'll see later that many of these are risk factors within our control. So starting off with objective 1, awareness is key. So we'll look at some stroke risk factors and warning signs. And you'll see here on this slide that there are some stroke risk factors within our control and others that are not. So starting with those within our control, we have high blood pressure, and hypertension is a leading cause of stroke. 47% of adults are estimated to have high blood pressure. Smoking. We know that nicotine and carbon monoxide in cigarette smoke damages our cardiovascular system. However, we still find that 1 in 7 adult males and 1 in 9 adult females smoke. And we're also seeing that youth have high rates of smoking as a result of vaping. Diabetes, while treatable, it still increases your risk of stroke. 9.7 million adults have undiagnosed diabetes. 29.3 million adults have been diagnosed with diabetes, and 115.9 million adults have prediabetes. So those are some significant numbers. Diet. A diet containing 5 or more servings of fruits and vegetables per day may reduce the risk of stroke. So just being mindful about what we're eating, how much we're eating. Physical inactivity. We should aim to be active at least 150 minutes per week, but ultimately the goal is just to move more and sit less. However, on average, we find that 1 in 4 adults engage in exercise that meets the physical activity guidelines. Obesity, a combination of both diet and physical inactivity. And then lastly, we have high cholesterol. So we know that large amounts of cholesterol in the blood can build up and cause blood clots. So on the other hand, we have risk factors that are not within our control. So age is one of them. The likelihood of having a stroke increases with age. However, we know that people of all ages have strokes. Family history. If you have a family member who has had a stroke, you may be at greater risk. Race. African Americans are at higher risk of death from stroke, and this is due to just higher prevalence of high blood pressure, diabetes, and obesity among African Americans. Gender. Women have more strokes than men. And then prior history. So anyone who has had a prior stroke is at higher risk of another stroke. This stroke risk assessment is from the American Stroke Association. And so it's a great tool to, one, just check your risk, but also a tool for conversation with your healthcare provider if you find that you are at higher risk in several of these areas. And so if you score higher, please talk with your doctor about ways to reduce your risk for stroke. And then just bringing awareness to stroke warning signs. I hope all of you here today have seen this acronym FAST. It stands for face drooping, arm weakness, speech difficulty, and time to call 911. And so I've linked a video here that just reinforces the use of this acronym for timely intervention. But some other sudden signs to look for would include numbness or weakness, especially if you're experiencing that on one side of the body, confusion, difficulty speaking or understanding others, trouble seeing, trouble walking, dizziness, loss of balance or coordination, and severe headache without cause. So it is possible to live well after stroke, and that starts really with secondary stroke prevention efforts and lifestyle modifications, as well as considering supports that are available to individuals. So I just want to again reinforce, speak with your doctor. Your doctor can speak to risk factors that are specific to you and some secondary stroke prevention efforts that may be necessary. So some of those would include considering healthy lifestyle modifications to address risk factors such as diet, exercise, monitoring and controlling, so specific to high blood pressure or those who are diagnosed with diabetes, just managing that blood glucose, and also limiting and ceasing alcohol consumption and smoking. So we'll look at these a little bit closer, starting with diet. So an easy modification would be to consider healthy alternatives or substitutions for your favorite foods. So a common one I use is substituting Greek yogurt instead of sour cream. So they have that same consistency, the taste isn't different, so I really don't notice. Eating more fruits and vegetables, Earlier, I mentioned 5 servings of fruits and vegetables daily. So just trying to incorporate those with each meal is an easy way to fit that in. Managing our portion sizes, something we often don't consider but makes a difference. Are we eating too little or too much? And being mindful of that. Tracking food intake. This is something I started doing when I noticed I was sluggish. I wasn't eating enough. So just being able to track my meals and snacks throughout the day, making sure I'm incorporating foods from all the food groups, but also taking it a step further to really ask myself, am I full after a meal? Am I satisfied? Also thinking about if we're eating when we're not hungry. Some of us eat out of boredom. I eat when I'm stressed. So just thinking about what led to eating when not hungry. And then again, being mindful about those portion sizes. Were there times where I maybe didn't eat enough or ate too much? And then also tracking water intake. It's important to just stay hydrated. And so I know I have a water bottle that has motivators on there and also checkpoints that keep me on track throughout the day to make sure I'm hitting my water intake. I'm a big assistive technology girl, so for each of these areas, we will talk about some tools and resources that are available. And so I wanted to be mindful. I know some of these can be expensive or just not as accessible for individuals. So I tried to include some low tech and high tech options here that we'll review. And so first, the American Heart Association has a food diary on their website. And so this is a great tool that you can print out, and it's paper and pen, good opportunity to just track what you're eating and how much, calories. And then there's an area for notes, which I like. So maybe I wasn't full enough after breakfast, or I missed my snack for the day, even though I planned it earlier. So a really great low tech option. And then I have a couple high tech. MyFitnessPal, I think this one's probably the most popular. I actually use this one. So there is a free version. You're able to access it on your computer. They have a website, or they also have an app for mobile phones. It's free. There's a paid option to upgrade, but I will say you can access everything you need with the free version. The paid upgrade really just adds some convenience factors of being able to take pictures of barcodes that will just track that food automatically. So within MyFitnessPal, you can log the food you're eating, see the calorie breakdown. It also shows you macros. Some people track macros. You can also track water intake in there, and then you can sync it with other apps. So if you're an Apple Watch user, you compare the two so that it keeps track of any calories burned or steps taken. BiteSnap, this is an app that's free and available on Apple and Android devices. Similar to MyFitnessPal, but a little bit more convenient. You're able to just take a picture of your plate and it'll automatically track what that meal is, maybe what ingredients it picks up on. And again, you'll see that it's counting calories and also giving you that macro distribution if you're someone that tracks macros. And then I threw a grocery list app in here as well. That is also free for Apple and Android devices. And I think this one provides a great visual when you are shopping or planning your meals, looking at the different food group breakdowns, so dairy, meat, produce. So just a good visual for you to make sure that you're incorporating foods from each food group into your diet. Some resources, sorry. The US Department of Agriculture offers MyPlate. So just a great educational website. If I click on one of these food groups, fruit, it'll tell me what foods are in the fruit group, how much I need in my diet, why it's important, the benefits. There's also recipes on their website. So handy resource. And then also I came across this one recently that I've shared with a couple individuals I work with. but the American Stroke Association offers a cookbook. And what I love about it is that there's a ton of different recipes in here, but they also consider different diets based on dysphagia. And so for each recipe, it breaks it down based on what that person can eat and how they need to consume that. So really helpful for all individuals. Next, we'll look at exercise. So again, I emphasize speaking with your doctor. There's not a program that suits all of us equally. And there are sometimes programs out there that are modified to meet your needs. So please talk with your doctor. The recommendation is that we get at least 150 minutes per week of moderate intensity aerobic activity. So going for a walk, yoga, Pilates, or 75 minutes per week of vigorous aerobic activity. So maybe going for a hike with some inclines, going for a quicker bike ride that has hills. But most importantly, the goal really is to move more and sit less. So I know for me personally, I work at a desk for 8 hours out of my day. I purchased a bike desk that I can use just to get moving throughout the day. My watch will tell me when I'm sitting for too long and need to stand and take a break to walk around. Consider resistance or weight training at least twice a week. So really just building muscle to decrease fat. And I wanted to highlight benefits of exercise. I think it's common that we often associate exercise with weight loss, but that's not the only benefit. So you'll see it keeps our body and brain healthy. It's a great stress reliever. It improves our mood, gives us more energy throughout the day, and helps us sleep better at night. So some tools for exercise. I thought of a fitness planner as a low-tech option. So this could be a calendar option where you plan out your workouts for the day or for the week. So maybe Monday you focus on arms, Tuesday is core. Maybe you list out what exercises you're going to do to address that. Keep track of how many reps or what your weight is. So you can try to increase your weight. And then something where you can physically check off that, yes, I did that today. Some high-tech options, you're probably more familiar with these first two. Apple Watch. So I have the Apple Watch. You're able to track your steps, track your workouts, keep track of how long those workouts were, what types of workouts, how many calories you burned. I also mentioned the stand feature. If you're sitting for too long, your watch will prompt you to stand and move around. Fitbit is similar. The Oura Ring is maybe one that people aren't too familiar with. And this is essentially, it provides the same thing that the Apple Watch or Fitbit does. However, for people that maybe prefer to not wear something around their wrist, it's a ring that will also track your exercise, your steps, but also sleep. So it's probably more comfortable to sleep in rather than a watch on your wrist. So another good option. Resources, the American Heart Association actually offers some YouTube videos of different workouts. And so most of them range roughly around 30 minutes. There are some shorter like mindfulness meditation on here. So great options there. Other options would be personal trainers. I know a lot of gyms have personal trainers on staff. Usually that first consultation is free, just to get to know you, what your needs are, what your goals are, so that they can create a program custom to you. There's usually a cost associated with that after the consultation, but also local fitness programs. So thinking about workout classes at a gym. So also including some socialization while you get that exercise benefit. Monitoring and controlling. So for this, I really focused on just high blood pressure and blood glucose. So again, some tools. We have a low-tech option offered by the American Heart Association, similar to that food journal, something that you can print off. You can track date and time of when you're tracking your blood pressure, and then you're able to bring this to appointments with your medical provider. So great paper and pen option. And some high-tech solutions. Nowadays, we're seeing more blood pressure cuffs as well as blood glucose monitors coming with Bluetooth accessibility. So they either will link to an app on your phone or maybe a website where all of that data is being captured. And then you can export it, print it, email it to either yourself, your provider, whoever you choose. And then we have some apps. CareZone is a pretty popular one that is free. And so with CareZone, there's a ton of features within CareZone, but you can track your medications, set medication reminders. And then it also allows you to track your blood pressure and blood glucose. And again, you have that nice chart that you're able to export and share with your provider. This first one is Apple only, but it is free. Blood pressure and glucose pal. Very similar to CareZone. What I like about this one is that you're able to get really specific about your recording. So for blood pressure, maybe you're tracking or checking your blood pressure before you stand and after you stand, just to see what that difference is. And then for blood glucose, it gives you the option, this is before breakfast, this is after breakfast. So really specific information that then you can share with your provider. And then blood sugar tracker, I know it only mentions blood sugar, but it does provide the opportunity to track blood pressure as well as weight and oxygen. So again, it gives you some nice charts and just detailed information that you can export and share. Some resources, these are all from the American Stroke Association, but I think it's important that one, you know how to measure your blood pressure so that you're getting accurate readings. And so they provide a nice visual here with some pointers on how to get the best, most accurate reading. And then these two, understanding the blood pressure reading. So if you're not sure what the numbers mean, you're not sure what action to take or when you need to call your doctor. So both of these are just more information about blood sugar readings and blood pressure readings. So then lastly, I really wanted to hone in on just supports that are available to stroke survivors and caregivers here in Iowa. So looking first at the supports offered by the Brain Injury Alliance of Iowa, we offer a fee-free service called Neuro Resource Facilitation. And so this is available to anyone in Iowa who's experienced brain injury or stroke, as well as family members. And so I provided contact information here. And the goal is to provide you with information and education, as well as get you connected to services and supports that are available to you in your community. And so what happens when you contact us is that you provide the county where you reside, and you're connected to the Neuro Resource Facilitator who's responsible for that county. So they're really the expert at knowing what supports are available there to help get you connected to what you need. So a great resource. Again, it is fee-free, and we connect with you as little or as often as you'd like. So good resource to have. In addition, we offer support groups. So we have a virtual group that meets weekly on Zoom. I would say that's a mixture of brain injury survivors, stroke survivors, as well as some caregivers. So a good mix. And then additionally, you'll see that we have support groups spread out across the state that meet monthly. I'm going to scroll, sorry. And then lastly, we have this Facebook group. It is a private Facebook group specific to caregivers across our state. So giving them the opportunity to connect with one another, share resources, and get support from other caregivers. We do have a YouTube page, And as I mentioned in the beginning, that's where this webinar will be posted later. But just looking at this, you'll see there's a wide variety of topics on there. We do try to record every virtual offering that we have so that you can go back and watch that at a later date and share this with anyone that needs that information. We do have a stroke tote bag, so this has specific resources available to stroke survivors and caregivers. And so I have linked here, we have a virtual version, but we are happy to mail physical copies if that is preferred. Accommodation tip sheets. Sorry, I'm getting click happy today. Accommodation tip sheets. So you'll see we have a wide variety of topics here, but essentially if you're somebody, maybe you struggle with memory deficits, we define memory, signs to look for, and then there's accommodations listed. So again, feel free to grab those from our website, or we're happy to mail physical copies as well. We do have some specific to professionals as well. Education, so just like this webinar, we provide educational opportunities, whether it's a virtual webinar or in-person conference in March. We have family caregiver workshops, but really our goal is to provide as much education as possible, whether it's in this platform or one-on-one. And then lastly, I'll speak to care coordination. I know I have some professionals here today, but also I think survivors and family members would appreciate this as well, is that Brain Injury Alliance of Iowa, we have a goal to always look for opportunities to engage individuals in our services as early as possible. We know that early intervention leads to better outcomes for individuals. And so what that means is that we aim to build relationships, whether it's a hospital, a rehab facility, prior to the discharge process, so that we can provide support to individuals who are transitioning to community living. So getting them connected to supports and services that they need earlier on in their recovery journey so that they can live a high quality life. Pivoting to look at some general supports, really my focus for this presentation was to keep it more general, more broad to the state of Iowa. Please know that there's a ton of community providers out there. So again, contact us and we'd be happy to talk about some local options in your community. But I do want to highlight the University of Iowa Hospitals and Clinics. They have recently launched a hybrid stroke support group. So while they have some individuals meeting in person in Iowa City, we are able to reach people across the state in Iowa through a Zoom link. So feel free to reach out if you would like more information on that group. In addition, the American Stroke Association has a support group finder on their website. And so on this page, you just enter your zip code, select how far you're willing or able to drive. And then once you hit search, it'll pull up any stroke support groups that are nearby to you. So a good tool. Assistive technology, again, this is something I'm passionate about, but it's something that a lot of stroke survivors utilize post-stroke. So in Iowa, we have Easter Seals as our state provider, and they offer a lending library. And so I'm logged in, so this would be your view after you create an account. But ultimately, the goal of the lending library is for individuals to be able to take a loan for materials and devices that are available on their website to really trial run. So instead of going on Amazon and ordering, whatever device you find first that may come in handy, that tends to add up quickly. So Easter Seals allows you to check out a device, test it out, see how it works for you, and then you can just return it and determine whether or not you'd like to purchase that item. So lots of great options on here. Easter Seals also offers durable medical equipment, so a little bit different than their lending library. For durable medical equipment, you're able to take that and use it for as long as you need it. So for example, if you're somebody who maybe needs a wheelchair after discharge until you're able to graduate to a walker, so maybe you just need that for a couple of weeks, you use it until you're done with it, you send it back, and then they're able to loan that out to another family in need. But you're able to keep equipment for as long as necessary. Another option for durable medical equipment is checking with your local churches. Oftentimes they try to have some of these things handy for community members that may be in need. And then another unique resource we have in Iowa is Jim's Place, which is through St. Ambrose. And so on their website, they offer virtual tours of spaces within a home. So sorry, this probably looks a little bit blurry on your end, but you're able to scroll around this bathroom and get a feel for maybe some areas that have been modified, some adaptive equipment that they have. And then also they offer decision trees. So you're able to see, I have trouble with, and we'll do poor coordination. And so then it brings up some assistive devices that would help with that area. So great resource. They're also available to contact one-on-one to have a more in-depth conversation about things that may be helpful. And then home modifications. The brain injury waiver does provide some funding for home and vehicle modifications if that's available to you. Another thing that I'll mention is home assessments. So sometimes it's nice to have someone come into the home and make recommendations based on your individual needs. So whether it's grab bar placement, maybe they recommend a shower bench, or maybe remodeling the bathroom to make it more accessible. So sometimes that'll be offered prior to discharge so that they can come into the home and address any needs before. Otherwise, there are also private entities who will offer that service as well. And then funding, we recognize that some of these things can get pretty expensive and they're not always affordable. And so Able Up Iowa is a program offered statewide for loans for some of this, but then again, also noting that we may be able to find some local funding solutions as well. So feel free to reach out to us to help navigate that. And then I wanted to be sure to highlight specific family caregiver supports. So to improve stroke supports, we also must value the time and energy that caregivers devote to supporting their loved ones. And so as a result, we have to support our caregivers. So some of these are a little redundant, but neural resource facilitation, again, that's open to family members and survivors. So please feel free to contact us. Support groups, all of them are open to caregivers. And then we do have that one caregiver specific group on Facebook. Family caregiver workshops, we offer these every once in a while. We just hosted one last Saturday that was well received, but providing an opportunity for caregivers to come together. On our website, we have some various caregiver resources. So again, we can print any of these and send those to you, or you can access them through the website. And then the American Stroke Association also has really, really great caregiver resources. Some talking about caregiver burnout, the rights of caregivers. So just good information to have. You'll see there's a lot there. So I've linked all of those. And then the American Stroke Association does offer a Stroke Family Warm Line. This is just a place for you to call and get some information and education, as well as they'll direct you to community resources as well. So with that, I probably spoke really fast, but that concludes the content that I have prepared for today. I'll go ahead and post the link to the feedback survey in the chat now, and I'll open the floor to any questions or comments that you have.